Hello. My name's Louise Jenkins. I'm the Head of School for Nursing and Midwifery at Anglia Ruskin University, and I work in the Cambridgeshire campus. I'm here to talk to you today about nursing. So, when most people think about nursing, what they think about is either a nurse as an angel, or they think about Florence Nightingale, or they think about Carry On, and they think about the matrons with the funny hats. In reality, nurses are highly educated, they work in really diverse settings, and they have a really diverse range of roles. So there are lots and lots of different things that nurses do. People sometimes ask why it's important that nurses have a degree. There is a perception that all they're doing is patient care and that doesn't need a degree. But actually a nurse having a degree is a really important thing. And we know that with every 10% increase we have in nurses with a degree, 7% less of their patients die. So it's really, really important for patient safety, for people's lives, that nurses are well educated and educated to degree standard. So there are different ways of different fields of nursing. You can be an adult nurse, you can be a child nurse, you can be a mental health nurse, or you can be a learning disabilities nurse. And each of those roles will focus on working with different people with different characteristics. More recently, there are also dual awards where you can finish a 4-year course and have a dual registration. So you might be qualified in both adult and mental health nursing, or you might be qualified in child and mental health nursing. And at Anglia Ruskin University, where I work, we offer adult, child and mental health nursing as a single degree, as a 3-year degree, and we offer the dual registrations of adult and mental health nursing or child and mental health nursing as a 4-year degree. So nursing is regulated by the Nursing and Midwifery Council, and nurses are autonomous practitioners. They're responsible for the care they provide, they're responsible for the decisions they make. They provide and they evaluate care. So they have a think about what's worked well and what they need to do differently. And nurses are leaders. They manage teams, they might manage wards, manage groups of people and other professionals. So it's a really responsible job. So they assess, plan, manage and evaluate care. If you want to be a nurse, depending on which university you choose to go to will depend on what they're asking for in terms of UCAS points. So Anglia Ruskin, we ask for 96 UCAS points, which is the equivalent to 3 Cs at A-level, but we are a widening participation university, so we're also looking at people who are doing BTECs, or people who've maybe struggled a little and come from different backgrounds, and we always will look at equivalent qualifications that you have. So if you do want to come in and you don't feel you've quite got the qualifications you need, still come and talk to us. Other universities, they might have different entry requirements, so it's important that you have a look at the university that you're looking to apply for and see what their entry qualifications are. We'll also ask that you have GCSEs in maths, English and a science, and it's really important that you have that good basic level of education to support your nursing career. And it's really important when nurses are working out how much drugs to give people, maybe an injection, that they're able to work out appropriate amounts of a drug. So a maths qualification is really important. Also, when you're coming onto a nursing course, we will ask you to come for an interview. It's a requirement of the Nursing and Midwifery Council that you are interviewed before you are offered a place on the course. So we will be looking to see what your values are, why you're passionate about nursing, why you want to come in. So nursing is a degree level course. It's between 3 and 4 years long, depending on whether you're doing a single registration or a dual registration. You'll spend half of your time in clinical practice and half of your time in theory. So when you're in theory, you'll be having lectures, you'll be doing group work sessions, and you'll be doing clinical skills, as well as independent learning, where you'll maybe have an assignment, something you need to be reading or revising for. When you're in clinical practice, you will be doing some of that time in acute settings like hospital trusts, and you'll be working across a variety of placements when you're with us. So you could be on any one of the wards, you could be in operating theatres, you could be in the emergency department. We also aim for all of our students to go out into the community to experience the diversity of roles that nurses do. So you might go out with a district nurse or maybe a health visitor. You might go to a GP surgery and see what a practice nurse does as well. So lots and lots of opportunities for placement. We know that it's quite a full-time course, so you are doing a degree as well as doing clinical placement, but we do give you some holidays. You'll have 2 weeks holiday in the springtime, usually 3 weeks in the summer, and then 2 weeks at the end of the year around Christmas time. Once you qualify as a nurse, we know that most nurses go into a band 5 role, and that at the moment the current rate of pay in 2020 is £24,907 per year. There is quite rapid progression once you qualify, so lots and lots of opportunities to do different things, and lots of our students go on to a variety of different roles, some of them in advanced practice, some of them in management or leadership positions, and some people, as I've done, go into education and research. So lots and lots of different choices for you. There's a huge variety of settings that nurses work in, and you can see here for each of the different fields the different places that students go to work in once they qualify. People are often worried about the financial burden of going to university, and they talk about student fees. So there are tuition fees associated with this course, but those are covered by a student loan. So the government pays the fees for your course directly to the university. You don't have to worry about that. And once you're earning over £25,000 a year, once you've finished your degree, you will start to pay a little bit of that back a time. So we know for people who are maybe starting out, they often are paying only maybe £10 a month, and that comes directly out of your wages. There is a maintenance element of any student loan, and that will depend on your individual circumstances. So it will depend on your household income. It will depend on what other commitments that you have. And you can go to the Student Finance website to have a look at how much you're likely to get as the maintenance element of your loan. Starting in September this year, the government has introduced funding of £5,000 a year to help with living costs for students who are doing nursing or midwifery degrees, and for some other healthcare students as well. So it's worth having a look and seeing if the course that you're doing is eligible for that £5,000 grant. And that element doesn't have to be paid back, so you won't have to pay that back once you have finished your degree. So it's really important. Nursing is a fantastic career opportunity. We know that nurses are in great demand once they qualify, and over 99% of our students hold at least one job offer, if not more, for when they qualify. So you are guaranteed employment once you finish your course. Lots and lots of opportunities. If you want to find out more, there are some websites here that you can go to. So UCAS Explore, you can go to the Nursing and Midwifery Council website. It's worth having a look at the Royal College of Nursing and why you want to become a nurse, or go on to university website. So the ARU website is really clear and will show you a little bit more about the structure of the course. It's been lovely to talk to you today. If you've got any questions about nursing, you might want to come along to one of our open days, so you can register and you can come and talk to our academics and students. Hope you're well. Nice to talk to you. Bye.